Okay, we might start the evening. Good evening, everyone. I'm Dr. Vinesh Bhatia. I'm the chair of the Education Subcommittee of the South Australian Maternal and Perinatal Mortality Committee. So, on behalf of the committee members, we welcome you to the 2022 Perinatal Forum. It is the 25th forum and the 15th to be titled the annual Dr. Brian Pridmore Forum. So we'd like to acknowledge this land that we meet on today is the traditional lands for the Ghana people and that we respect their spiritual relationship with the country. We also acknowledge the Ghana people as the custodians of the Adelaide region and that their cultural and heritage beliefs are still as important to the living Ghana people today. So it's certainly been a challenging 30 months, but we are hopeful to be coming out of the COVID driven bubble. And we were absolutely intent to bringing this forum to you this year. We'll be bringing this forum to you both face to face as well as a virtual event. And we have a QR link up here through which you can provide us feedback for tonight's forum. It's important for us to have your feedback because it helps us in preparation for the next forum. One of the feedback suggestions in the 22nd forum was that we wanted to know a little bit about why we are called the Brian Pridmore Forum and who he was. So Dr. Brian Roy Pridmore, he graduated from the medical school at the University of Adelaide in 1964. He worked in South Australia, Northern Territory, and New Zealand before he went over to the UK to begin his training in obstetric and gynecology. He obtained his membership of the Royal College of Obstetric and Gynecology in 1971, and he became the Foundation Fellow in 1978. And he obtained his Diploma of Diagnostic Ultrasound in the same year as well. He returned to Adelaide in 1974, commencing his work at the Queen Elizabeth Hospital, where he worked in the obstetric and gynecology department for almost 40 years. He became the head of the department in 1988. Among his many feats, he was the chair of the perinatal subcommittee of the State Maternity, Perinatal, and the Infant Mortality Committee. He also importantly led to the introduction of the antenatal shared care and developed the template for the antenatal shared care, which we now use in the state. He was an important advocate for the team approach in obstetrics, especially between obstetricians and midwives. And he was the first to introduce the pregnancy handheld record, which is now extensively used throughout the state. Finally, he was inaugural chair of the organizing committee, which was at that time called the Forum, and which was named in his memory in 2007. We would like to thank today Dr. Megan Mitchell and Ms. Andrea Dewson from the University of Adelaide, who have been helping us with the venue arrangements and the Zoom, and we are very thankful for their time. We also thank Anthony Colicchio, who is from the WCH media team, who is assisting us with the filming of tonight's presentation. The edited version of the forum is placed on the SA Health website, which allows our colleagues who are not here to have access to the presentation. The previous forums are available online via the SA Health website as well, and we continue to encourage you to view the previous forums and as well as encourage others to see them. So if you go on to the SA Health website, you can access the forum by going into the clinical resources and then going into the A to Z clinical resources, and there you will find Dr. Brian Pridmore Forum, and you can go into it and it will take you to the previous year's forums as well. So as part of the committee, we are also requested to bring the recommendations of the Maternal and the Perinatal Mortality Committee, which would be coming out in the annual report. So there were two recommendations from the committee. The first one was that acute fatty liver of pregnancy is a rare disease of the third trimester, which constitutes an obstetric emergency and is associated with maternal mortality. Women who present to their care provider with non-specific abdominal issues such as nausea, vomiting, malaise, or a change in stool color should be assessed with a high degree of suspicion and be reviewed by an experienced clinician as a matter of urgency. And the second recommendation was that in some cases, pregnant women who do not have access to Medicare have chosen to a model of care that they cannot afford rather than the most appropriate model of care for them. So all pregnant women assessing care in South Australia, including those not recognized by Medicare, should have access to fully funded obstetric services. So that was the second recommendation. I would also like to thank all the committee members of the subcommittee for their continued support. Firstly, I would like to thank the outgoing members, Dr. Tracy Bradbury, who was the previous chair of the committee, and also RM Anita Ola. We really thank them for their valued support. I would also like to welcome our new members. One of them is Dr. Beth Russ, who's joined the committee. She will be introducing our speakers tonight, and also two midwives, RM Renee Baig and RM Lauren Kleinig. So please welcome to the committee. Our other members of the committee include Dr. Morgan Vatani, Dr. Amy Wilshire, Dr. Ken Vanguhu, RM Kim Parker-Gray, and RM Christy Roberts. One of our most important members, who's otherwise enjoying his retirement, is Dr. Brian Wheatley, who's present here today, and who has continued to tirelessly support our team, even though he's not been in the country most of the time. So we're really thankful of his support. I'd really like to have a round of applause for Dr. Wheatley. And last but not the least, we would also like to thank Kylie Bryant, Senior Midwife, Maternal and Perinatal Mortality Committee in the Pregnancy Outcome Unit. She's been instrumental in organization of the forum. Thank you very much, Kylie. So to this year's forum, we are very thankful to our invited experts who have kindly volunteered their time for this education night. We have our experts, Professor Grant Sudders, genetic pathologist, Miss Linda Howell, founder of the Beat Movement, Dr. Alice Robinson, obstetrician, Professor Martin Ola, who's a gynecological oncologist, and Dr. Christina Sibin, who's one of our neonatologists. At the end of the four presentations tonight, there would be a Q&A session, and where you'll be having the opportunity to ask any questions. And we will try to coordinate the questions from people who are present face-to-face and also for people who are on the Zoom. So please feel free to send us your questions as and when they arise. So Mitotic Melody and Melody, an interactive forum regarding the challenges of cancer in pregnancy. We have a wonderful group of speakers tonight, all experts in their field, and we can't wait to hear from them to impart their knowledge onto us. So without any further ado, I'll hand over the mic to Dr. Beth Russ, who will introduce our first speaker. Thank you.